Hi, everybody. Welcome to this webinar to present the English version of this data science project scoping, a guide for social good organizations. My name is Maria Paz Hermosilla. You can call me Maria, and I'm the director at GobLab in Chile. We are a public innovation lab located at the School of Government of Adolfo Ibáñez University. It's a pleasure to have you here.
My name is Raed Ghani. I am at Carnegie Mellon University in the machine learning department and the School of Public Policy. And good to have you guys here as we talk about some of the work we've been doing.
Great. Well, so we're going to talk. We also have in this slide we have an acknowledgement for ITAM, which is University of Mexico, where Adolfo de Unanue is, and he's one of the creators too of this guide. So we also acknowledge he isn't able to be here today, but he is also a creator. And he was in the Spanish version that we had in late December. So what's going to happen today in the webinar? Well, we're going to introduce you to the guide for data science project scoping. This guide was created specifically for governments and nonprofits. And then we're also going to show you what's the curriculum that we created, and we piloted it in Chile to teach this methodology, and also some of our training programs that we're having and the resources that are freely available online. So just to how did Chile and the US get together? Well, we basically, in 2017, we found out about the Data Science for Social Good Fellowship that Raed has been running since 2013. And it was through that fellowship that this methodology was created, this project scoping, how to take a problem, long lines in a hospital, ambulances that don't arrive on time, children that are being poisoned by lead, whatever problem it is. Of course, we're talking here about social problems, public policy problems, how to take those into a data science project, how to see which problems we can solve with data science and put together that project. And so this was done through the fellowship that Raed ran, and that many other, it was done in Europe, and it was done for 6 years, and we thought it was a really good methodology, so we started teaching it in Chile through our program, and then we won an innovation grant to actually develop the curriculum to be able to teach it, and we translated it into Spanish. So that's a bit of the context. And we've been collaborating with Raed since 2017 when he came to Chile, and now are also collaborating with ITAM, the University of Mexico, and because both Raed and Adolfo were in Chicago before. And so the 3 universities are going to continue to work on this curriculum, and this is ongoing work. So we're developing new materials that we're gonna continue to share with you. So that's a bit of the context.
Yeah, and I mean, the larger context is, the US spent a lot of time helping destroy Chile. So now we're trying to help Chile and save them from all the economists that did to Chile, all those things. No, but more seriously, I think a lot of the content that we had produced initially for data scoping, was very much English centered, and given the need in different parts of the world, we were really excited to collaborate with Maria and Adolfo in Mexico and Chile to create a version for Spanish-speaking countries that is designed a little bit more customized for the context and the needs. So we're kind of excited about the partnership, and also open to other organizations working with us to expand the curriculum, as well as to create local versions for different languages in different regions.
Great, yeah, and I also want to do a little shout out to Andres Letelier. He's on the webinar, and he was one of the, he was a teacher here in Chile, helped create the curriculum, and then scooped up by Google, and is now in the US. But so also a shout out to Andres, who's connected today. Thanks for joining us. So So the question that brings us together is what's on the slide: projects that are actionable and result in positive social impact, of course, because there could be social impact that's not positive. So that's what brings us together. And why scoping is critical? Well, basically, many innovation projects always start from the solution, and this is very common. So people kind of fall in love, in this case, with data science. You know, you get really excited because you really want to do a predictive model, and you're very happy about that, or you want to do a neural network. But that's when you start by the solution, you're skipping a lot of stages, and many times that can be critical, and it will end up influencing your project in not in a good way. You need to really understand the problem and see what if the problem is ready or mature enough to use data science. And also in the process, sometimes you'll find out things you have to do to be ready. So you'll understand the maturity of your data, and you'll set goals that are the goals that you really want to solve, the problem that you really want to. Your goal is not to create a model, but your goal is to reduce lead poisoning in children, for example, which is one of the projects that Raid did, which I think is a really great example of how data science can improve people's lives. So that's why scoping is critical. We really need to make sure that we're also, it's very scarce resources. So your time is valuable, and it should be used in problems that can be solved with data science, and not wasted, you know, in things that won't work, basically. So it's dedicating time at the beginning of the project, which will really help your project be successful. And part of the scoping phase is actually doing an initial screening. We also call it pre-feasibility. It's really important, and part of the methodology is teaching you how to do that. There's 5 criteria that we teach you in the course. It is basically they're there on the screen. It has to be a really real and significant problem. You have to be able to quantify and describe that problem. You as an institution have to be able to do something about that problem legally, and you have to have interventions, to what we call actions, to actually do something about it. If not, you should partner with those that can, but then of course you need priority and commitment. Implementing a data science project will require a lot of different people, not just the IT or the data science team, your leadership, but also different areas within the organization. And it will probably require changing the way you do some things. So that's why you also need commitment from your organization. And of course, you will need data, which is usually how many people start. But so you do need data for a project to be initially pre-feasible, but that's not the only requirement. It's only 1 out of 5. And of course, the other very important thing before you actually scope a project is understand what the risks are. And within the methodology, we walk you through that process. Raid, you want to go ahead?
Yeah, so I think those things that Maria was talking about are things that you want to sort of consider very early before you even decide this project is worth continuing, right? If it's not important, if you don't have data, if you don't have the commitment, then it's not really worth going through the scoping process, because you first have to get those things ready. Once you have that, what we've sort of done is, over the last few years, you know, in the beginning, when we were starting to do projects with governments and nonprofits, the biggest challenge we actually faced was organizations coming in without really a well-defined idea of what they want to do. And so they'll come in and say, oh, we are a school district and we want to improve education. Well, great, we all do, but you kind of need to be more specific. And you want to be more specific because you want the project to result, as we said, you know, result in positive impact. You know, we don't want to build a map, we don't want to build a dashboard. Those are wonderful ways of wasting time and getting nowhere. I mean, I'm sure a lot of us have gone through that process of, you know, spending a lot of time doing work that results in zero impact because we didn't quite have our things right in the beginning. And so the idea here is we're interested in having positive social impact. And because of that, we want to define a project scope that's sort of driven by a goal, where there's a very clear goal and then two, where it's actionable, where we're going to change something as a result of this project. If nothing's going to change, then there isn't going to be necessarily an impact. So there are 5 pieces that we've kind of found to be critical in this process. Step 1 is really understanding and defining the goals of the project. And we want the goals to be, again, as I said, specific, right? It can't be as high level as improve society or improve the health of people or improve the employment situation, because those are good goals to have for any agency, but they're not necessarily actionable. They're too broad. And so for us, a goal becomes something that's concrete, that's measurable, and often there are multiple goals, right? And this is not a thing that's limited to the public sector. So here are sort of 3 goals you might have, right? In the beginning, what turns out, a lot of government agencies have been using data as a way to be more efficient. They want to use the taxpayers' money really efficiently and make sure that we help as many people as possible with the limited resources we have. Now, the challenge with that goal is, if you want to help as many people as possible with fixed resources, you might end up helping people who are really easy or cheap to help. And that's going to leave certain people behind who may not be easy to help, but they really need your help. And that leads to equity and fairness issues, where you end up in a society that's really inequitable. And so you might sort of say, well, if I want to help a lot of people, I'm going to put all my resources in large, big cities. I love large cities, but there are also people living outside large cities. And so efficiency may not necessarily be the same as equity. And the other pieces, that your effectiveness of the program might also need to be taken care of. So what you want to do is define these goals and then figure out relative priorities of these, right? And so here are kind of some guidelines, right? The goals need to be measurable and concrete. It could be, I want to increase the number of people who are graduating from high school based on the interventions that I'm doing. And so that's one goal. But the second goal might be, I also want to make sure that I am getting to outcomes that are equitable, so that the graduation rates equal graduation rates across male and female, and equal graduation rates across all the different races, and all the equal graduation rates across different zip codes. And if that's my goal, I have to figure out the relative priorities and trade-offs. What am I willing to give up to achieve a different goal? And then, as I said, the goal of a project is not to analyze data, and that's going to happen a lot, where you have some data and you want to analyze it and you want to visualize it, but that's not the goal of the project. That might be an analysis you do to achieve a goal, but that's never the goal, to build a predictive model or to make a prediction. And you'll see sort of a lot of people will start with that goal. It's like, what do you want to do? Well, I want to visualize my data. Well, why do you want to visualize it? So I can understand it. Well, why do you want to understand it? So I can change how I allocate resources to improve, reduce lead poisoning, or to reduce, unemployment. And so that last piece is what the goal is. You just have to often get people to that point where they can connect the dots about why they want to visualize it, to understand it, to then do resource allocation. The last piece, or the second to last piece that's kind of really important, is what constraints do you have? And it may sound obvious, but sometimes, when we work with different government agencies, they'll come in and say, I want to reduce X. So I want to reduce, again, lead poisoning, or reduce the number of students not graduating from high school, or reduce recidivism rates, and we'll start ask them, do you want to do it for, who do you want to prioritize? Do you care about certain people? And say, oh, we want to do it for everyone. Okay, well, if that's the case, do you have infinite resources that you can provide to everyone so you can make sure everybody is achieving that goal? Like, oh, well, we don't. So then you can't do it for everyone. So what are the constraints, whether it's resources, whether it's political constraints, whether it's money that you can allocate to this problem, whether it's that the money has to be allocated in different regions in different proportions. So what are the constraints that you have? Because those constraints are really important. And sometimes what you have to do is be very extreme about these types of things. To sort of, for example, somebody might say, one of the organizations we're working with said they were responding to 911 calls or to emergency phone calls for dispatch. And they said, we want to respond, we want to make sure that we respond to them as quickly as possible and the call times are as short as possible. So we want to reduce the time our people are on the phone with somebody. Well, if that's your goal, the easiest way to do that is to cut that time down to 0, which means get rid of your phone line. So if nobody can call you, then your average time goes to 0. And then they said, well, no, we still want to help people. Okay, so then that means that the goal is to resolve these questions quickly. And that wasn't a serious, consideration to shut down the phone line. But sometimes you kind of have to think about how do you take to the extreme to figure out the constraints. So the goal is to reduce the time, but the constraint is that you still want to solve people's problems, because otherwise you can just get rid of that service you're providing, and that reduces the time you're spending achieving that goal. Next. Yeah, so this is just, I think, some examples of templates of problems that we have found that make it easy for organizations to scope these types of projects. We're not going to spend much time here. These slides will be available. So systems like early warning systems, if I can tell you something early before it happens, I can intervene early. Inspection type systems to figure out which inspections to prioritize, how to schedule things more effectively, how do you do routing, how do I improve my policies, how do I measure impact, and how do I turn data that might be video, audio, text, language into rows and columns that analysts can then look at and make sort of policy decisions. So we're not going to go into this in detail, but it'll be available. And so here are sort of 6 types of problems that come up fairly regularly in working with governments and nonprofits around the use of data science, that once you figure out where your problem belongs, then you can use a lot of the methodology and tools that exist for doing these types of projects. Okay. So this piece is, we've figured out what we want to achieve. Now, you need to have actions that can help you achieve that, right? What are your interventions? What are the actions you're going to take? And the way to think about it is really, what would you do differently if you had better information about what you're trying to do, right? So for example, in the case of students who you're trying to help with education, or in the case of an employment agency who's trying to help people get jobs, you might be connecting students to training programs, after school programs, first come, first serve, where they come in and sign up. Now, maybe what you want to do is, the goal is to connect them with programs. So taking students who have a need, who are unlikely to graduate without that, and who can benefit from this program. And so how would you, if you knew that, how would you change your actions? And so who would you prioritize for this intervention? Would you prioritize different students? And then your intervention might be, which program would you connect them to? And how would that program be delivered? So let's say you have different programs. You have a really expensive program that only 10 people can be enrolled every week. You have a cheaper online program that's 1,000 people can take it. And you're trying to figure out, how do I allocate students to those programs? And so you have to have these interventions. And so that helps you figure out what you need to do afterwards. And so a really critical step in the scoping process is to figure out what interventions or actions you have access to. What do you do today? Whether it's lead poisoning inspections, whether it's mental health outreach, whether it's after-school programs, whether it's inspections for housing and for health and safety, whether it's audits if you're doing any type of fraud type work, whether it's again other types of preventative services if you're doing healthcare where you're providing doing outreach to reduce the risk of something. Those are the actions you're taking, and you have to kind of have a list of them and figure out what do you have, because then later on we're going to use these to change what we're doing.
And in this step, it's really important to understand who is doing that action. For example, inspections is a classic. For example, we were working with the fishery service in Chile. They try to avoid illegal fishing. And so they have inspectors that go to the ports, and inspect the boats, where fishermen, they have their, the tons of fish that come out of big boats, small boats, etc. So you really want to understand how the inspector works. For example, if in this phase you identify that 40% of the salary of the inspector comes from the way the inspections are allocated, and you are going to change that. This is something you need to find out right away, because if you do not know this, you create your beautiful system that will send them to inspect the most risky boats, but then it turns out that your system completely changed their pay grade. And then you have a strike on your hands because all the inspectors have, the unionized inspectors are now against your data science project. So you really need to understand what is the concrete action, who does that action, how is that action done, what information that person or whoever does the action needs, the incentives around that, and really how your system is going to be deployed in reality, and understand the human part of it. This is key for a system then not to be, because you could create the system and then it will never be used, for example.
Yeah.
Yeah. Well, this is a bit more about actions. Yeah.
More details about actions. And again, a lot of the slides are there for you to kind of look at later on if you need to refer to more details, and we're not going to cover, everything. So the third piece is data. And if you notice, the data is coming after we figured out, is this a real problem? What's the goal? And how can we change? What are the interventions? Because we don't want the data to come first, because without having a real problem, defined goals and interventions, data is pretty useless. And a lot of us, we want to analyze data, but only if it makes sense and only if it has the impact. So when we get the data piece, we want to figure out what data sources do we have access to internally, and that's going to be the primary data. And most projects are going to require, a primary data come in if you're dealing with, again, education and health and criminal justice, transportation, public safety, environmental things. There's going to be some primary thing, whether it's people, locations, organizations that you have information on. And one thing to and then you want to figure out, what is this data at the right level and enough, and does it connect to what you want to do, right? So for example, if your interventions, as Maria was saying, if you're going to intervene by doing an inspection and go check a certain part of the water for illegal fishing, or if you're doing an inspection of a home, or if you're doing an inspection of a restaurant or of a business, but let's say your data is aggregated at the level of large regions or cities or neighborhoods, then if your data is not at the level of your intervention, then you can't really intervene at an individual level. If you only collect data at the school level, but you're intervening at a student level, then there's this mismatch. So it's important to kind of think about, often at this stage, you might find, well, we actually don't have individual level student data. So what do? Well, you have two options. You can either go back and say, maybe I should change my intervention. Maybe I should change my intervention to be school level. Or maybe that means I have to change my goal and go all the way back. So there's an iterative piece that happens to try to figure out, do I have the right data? And if I don't, I can either update my goal or interventions, or I might go and find additional data. So that might be external data, either through public sources or private partnerships. There might be companies that have access to data that you can build partnerships on. And then once you have that, the way you get that data is you sort of have to go through, you're not going to get a list of data sets that this organization has, because nobody in an organization knows what data they actually have. And some people might actually throw different acronyms at you to sort of, dissuade you from getting data. And in the US, it's going to be things like HIPAA and FERPA. And you want to make sure that you're following those laws and those guidelines, but you don't necessarily want to assume that data cannot be used for those purposes. So you're going to have to learn about those acronyms, go deeper into what they mean, what you can use data for, what you can, and we'll come back to that towards the end around when we talk about ethics and privacy and those concerns. Yeah, so this is more around sort of how do you assess if you have the right data and if it's accessible and usable. We'll skip through that. So now we get to the piece where we're probably going to spend the most time in the project, right? And this piece is towards the end exactly for that reason, is because we want to make sure that we've defined the project really well so that when the analysis happens, it's the right analysis and it helps us achieve the right goals. So the way I think about analysis is, what analysis does is it basically takes the data that we have and connects it to inform the actions that we're taking to achieve the goals that we want to achieve, right? So the analysis is kind of the connector in the middle. We have data, and data by itself isn't that useful. But by doing this analysis, we can now inform the actions that we want to take. Now those actions will be better, and they'll be better because it'll help us achieve the goals that we set out in the beginning. So it's the scaffolding around everything that helps us. And what we need to figure out is three big questions, right? What analysis do we need to do? Once we figure that out, is what type of methods we're going to use. And once we figure that out, probably the most important piece is the third one, which is how will we validate that this analysis was done correctly and that it does help us achieve the goals that we started off with. And so then we'll try to figure out what are the different analyses that can be done. And here kind of 5 typical analyses that happen around describing the past for understanding, detecting ongoing real-time anomalies, patterns, outbreaks, predicting the future, optimizing, and then trying to change the future, do the causal inference. And the only thing to kind of remember here is that for most projects, you're going to use one or more of these. So you might try to predict who's at risk of again, as Mary was saying, lead poisoning. Then use optimization to figure out how to allocate inspectors to different at-risk homes, and then try to figure out how do I change the behavior to actually change how to reduce the lead poisoning. So it might be a combination of different things. And for every project, we should figure out how to do that. This is probably the most important thing once we start the analysis, which is how do we validate what we've just done? And there are going to be 2 types of validation, right? One type is the analysis you did has to be correct and done well, and let's say the analysis was prediction. So you have to validate whether the prediction was correct or not. But then you have to actually run a field trial, a pilot that tests whether using this accurate prediction helps you achieve the goals. Does it help you reduce lead poison? Does it help you reduce or increase graduation rates? Does it help you increase employment opportunities? So there are 2 pieces. There is evaluating the analysis, and then there's evaluating a system that you built through the field trial. And then you have to kind of deploy and continuously monitor to make sure that it continues to improve what you wanted, improve the goal that you set up, as opposed to a one-off system. And then, the piece of all of this work is happening, and the data and the ethics issues the ethics issues are throughout the scoping process, right? They don't come in at the end. And that's why if you sort of look at the way we describe it, is the ethics issues are coming in throughout the scoping process, in defining the goals, making sure that equity is also a primary goal, in defining the interventions. Could the interventions hurt people? Do the people who are being intervened on, do they know these if they're being intervened on? Can they opt out? In the data piece, privacy of the data, security of the data, ownership of the data. And then in the analysis piece, making sure that we're reducing any sort of discrimination or inequities that might be happening. And there's sort of specific questions you want to ask about each of these areas, right? So on the piece on the privacy, if you go to the next slide, we want to identify whether we're working with personal or sensitive data that's identifiable. And if we are, how are we protecting the data? Does the data need to be at that level? And if it does, we have to make sure we protect it. And we have the right security policies in place and the confidentiality policies. Same for data ownership. Do the people who own this data, the people who generated it, know that we're using this data? Do we have their permission? How did we get their permission? Can they opt out of their data being used? How? And how would we test and see if it's actually the processes exist? Same for the private transparency piece of it. People whose data it is, do they know that we're using it? What actions are we taking on individual based on this data? If we're intervening on somebody, even if we think it's good for them, do they know that they're being targeted or prioritized? And do they know why? Do they have any recourse in saying, no, I don't want to be part of this? Can I opt out of this? And if everybody found out what you were doing, would it be a negative headline in a newspaper? And who should know about what parts of the project? Around sort of discrimination, equity, fairness, which groups do we think we want to make sure that are treated equitably? How do you decide on those groups? And then how do you define what equity means? And do you have the overall social license to actually do this type of project? If the world found out, or the entire country found out, are they going to say, yeah, that makes sense, I'm on board, I like it? Or will they be appalled and start burning train stations? And then who is accountable for all of these different actions? For each of these different pieces, who are the people accountable and responsible for this? And if something doesn't go right, who is the one who's going to have to take responsibility? And then any other legal or constraints around what can we do, what can we not do, how do we get the data, how do we protect it, all those different things. So I'm going to now pass it over to Maria. She's going to talk about the pilot course that they did in Chile last year.
Yeah, so basically what happened was that we got a grant to develop a curriculum to teach this methodology that, Raid had tested with over 100 social good organizations. So we got a grant from the Chile Innovation Lab, which is Laboratorio de Gobierno, and they have a innovators network. And also we got the support from the civil service in Chile, which is the one, who oversees human resources policies all over the country. And that allowed us to first work with Raid and Adolfo and Andres to design a 3-day class for people to come in. People would come to the class with a problem, so they would apply, with this thing is happening. In my hospital, people are not arriving to their hospital visits. We're having 20% of people that don't come, and this is causing a bunch of problems. And then during the whole course, we actually had a hospital director in the class. They would, using this methodology, work on their problem to turn it into a data science project. And we had 71 public managers from 50 different public agencies in 2 different cities. You can see them there. And it was an innovation project, so we also improved the curriculum during the course and after the course. All the lessons learned, we met with Raid and improved the materials. So everything that you were going to see in our website is already improved through this process. And so this curriculum is a 3-day curriculum. We've taught extracts of it in, like, I have like a half-day extract as well, but the 3-day class is very well defined, and it basically it teaches people how to first understand the feasibility. So that's what we were talking about at the beginning. Is it feasible to use data science to address this problem? Then define the goals, define the actions, define the scope, turn it into a project plan, and understand the ethical challenges. So this is part of the goals of the curriculum. And the audience of this curriculum, and that's the curriculum that we've shared for free and are launching today in English, is basically any person who works in government. Of course, it's more intended towards managers because they're the owners of the problems and they need to solve them. But it could be, we've had people from Congress, from the judiciary system, all levels of government, from municipality to national government. And this curriculum is not made for analysts. A data analyst could take it, but it's made for anybody who's just the owner of the problem. You do not need to know anything about data science to actually take this class. And
I think one of the things is that it is designed to make sort of the lives of analysts, much easier, right? Because then you want to be part of the process, but you want to make sure that problems that are being handed over to you that you're working and spending time on are actually real problems that have been well-defined, well-scoped, and that your work is going to have impact that you want it to have. And you might not have control over the entire process. So we're kind of trying to make sure that people who are bringing problems to you and managing teams that are working on it are better equipped to give you better problems and make sure that the work has the impact it needs to have.
Yeah, we also had some people from like IT, like join the course, or data scientists, heads of a data science team, and it's a helpful methodology for those people to actually work with the other areas to define the problem as well. So it can really help anybody who wants to take the class, but you don't need to know any data science. And the course is divided into 3 days. We've uploaded a curriculum with instructions for the instructors, with all the activities. And basically, there's 2 homeworks. So you actually come in with a problem and you come out of the course if your problem is worthy of data science with a project. If not, you'll come out with many things you need to do. Or during the course, a lot of people change their problems and they end up doing different projects because they realize that what they wanted to do wasn't feasible or useful, or etc. And yeah, so that's kind of how it's divided, but you can read that in we have a longer description where you can, if you're interested in actually this curriculum, you can see that online. And the resources that we created through this project were, we updated, well, there's a project scoping guide that was written by Raid and was updated. We also have the worksheet, which is like it's like a template where you fill in, it's what we use for the homeworks. So that's the basis of how you will, all the questions you need to answer about your project. And then we created the curriculum, all the activities for these 3 days, and we recorded the lessons, so they're in Spanish, and all that is available there. We also translated to Spanish the maturity model created by Raid, the data maturity model, which you can use to assess the maturity of your data. And we also created a list of readings, like optional readings, because you don't need to read anything to be in this course, but if you do want to, we also have a list of those readings. So all this material is in English and Spanish, except for the videos, which are just in Spanish. And we're gonna have, so our goal is for this to spread around the world. We're teaching this class in Chile twice this year, once starting in April and the other one starting in August. And I know that ITAM in Mexico is also planning to teach it probably in the 2nd semester, which would be the fall semester, I guess, in the US or in the Northern Hemisphere. And in Australia, Rayid and I are going to Brisbane and Canberra to teach a day version of this curriculum with the University of Queensland. So I don't know if, are you going to teach this at Carnegie Mellon? Well, you're in the fellowship, of course, you use this methodology, but.
Yeah, so we've been, one of the nice things about having it as a curriculum. So what we used to do before is we used to kind of run one-day workshops for students and bringing in different government agencies. And I think having a more structured version of the curriculum allows us to sort of deliver in different ways, right? So you can imagine creating versions of it that are 2-hour long, half day, 1 day, 3 days, and possibly longer. So one of the things I think, we'll be teaching different versions of it. And I think this is useful for a lot of you in 2 ways. One is you can also teach these things in your own organizations or to your peer organizations, but you can also see when we're running these workshops and ask us if you can attend in any way. Whether we haven't quite done remote workshops like this, we typically do them in person. But if there's interest in learning how to deliver it, come talk to us. But if it's also an interest in attending or creating a custom version for different, for criminal justice or for workforce development or for other human services, we can also try to see if we can create slightly more custom versions for that you can take and or deliver within certain areas.
Yeah, if you're working in data science for social good, like if you actually are doing these kinds of projects, we'd be interested in connecting because we do want this curriculum to spread. And as Rayid said, we could see how to train you to actually do this curriculum. And we in Chile, for example, we're going to do a version of this class for an agency that does drug and alcohol prevention. So it can be also done just in kind of one major topic. So those are the options available. And yeah, we're really interested. I really believe, so I came to data science being a former government official, and I was a public servant. And there's so many problems, and I really think that data science is a key tool, not the only tool, of course, to solve public problems, but a really important one. And this methodology, I think, really brings the problem to the data science and kind of does the connection. And we really need more managers out there that understand which of their problems can be addressed by data science. So, Ray, do you want to talk about this ending slide?
Yeah, and I think if you're the person so this is more designed for people, from probably the opposite side of where a lot of you are, because a lot of you are probably inside governments, and this is sort of for people from our side. When I sort of work with people who are scoping these projects, I often give them these guidelines and about sort of, don't ask naive and open, questions, because you're coming into this new area, and the only way we can learn is through asking these naive questions, because I think it pushes people to the extreme. Right. Second is, again, with the working with governments, equity and fairness is something that politicians talk about, but have no idea how to actually implement. And so as people who are building these systems, it's important for us to make sure that we highlight that piece, but also actually help define that. What does it mean for recidivism outcomes to be fair and equitable? Well, it's not obvious, and we've actually spent a lot of time on working on these types of problems. The third piece is understanding how does this problem get solved today. We didn't kind of talk about it in the scoping phase, but as you have these discussions, you want to understand how is it being done today, because that helps you understand how it could be improved. Same for communication. The analysis we're doing is important, but we have to convince people to work on this project. We have to continuously communicate them to get information from them, to provide them information, and then we have to convince people to use what we have just built, to test it and to use it. And so we need to learn how to do that better. and we have to make sure that we do them responsibly and ethically. And then we have to remember that in all of these types of problems, the types of examples we've been giving, apologize, they're not automated solutions, right? They're not, you build an automated ad delivery system, like some people in this, or shopping systems, and it just does everything for you. You have people who are in the loop, who are actually doing things on the ground. And so we have to kind of remember that we're building all of this for people to help them serve other people better. And so they have to be kind of designed with people in mind, with all the perfections and the good and bad of the people that come along with, and make sure that, you know, we're thinking about both the people who are going to be using this and the people who are going to be impacted. Do you want to click on that and kind of just scroll through that to give people can take a look and see what's in there, or the scoping sheet, just so that this is kind of a worksheet that we've built that we use for scoping projects, and it's kind of an improved version. And let's see.
Let me, oh, there it is. Okay, are you seeing it? No?
I'm not seeing your PowerPoint.
Okay.
But it's,
yeah, I'm opening up.
while you're, okay, there was a question I was gonna ask. Okay, so this is the same question that we've talked about, right? What problem are you facing? Who's affected by it? How much are they affected? Why is it a priority? What are the goals? Right? And what are the constraints? And what's the prioritized order of these goals? What interventions, what actions do you have? Who takes it? What is being taken on? Is it an inspection by an inspector of a house, or is it enrolling a student in an after-school program? How often? Is it daily, weekly, monthly? What data do you have internally? What does it contain? How often it's updated? How it's stored? Is it linkable to other sources? What can you get from external sources? What analysis you're going to do? How are you gonna, what type of analysis? How are you gonna validate it? So basically, it's a summary of what we've covered. What are the ethical issues, privacy issues, equity issues? So this just gives you one place where you can create a project scope, and then, you know, get an agreement on some of these things up front, so then you can use this to create a project plan going forward.
Yeah, we should answer the question.
Yeah, so Jane is asking about, after we deploy an intervention, how do we monitor the outcome measures, and will there be a time to stop the intervention? So that's a good question, right? So I'll just pick on your example, Jane. So there's a project going on right now with Johnson County, Kansas, which is trying to reduce the recidivism rate through proactive mental health outreach. And so the analysis that was done was to figure out, you know, can we accurately predict who's going to come back to jail? And that we could test, and found that that was accurate. Second step was the people that we predict as high risk, if intervened on, if provided these mental health outreach services, will their recidivism risk go down? And so the trial that's actually running right now, which Jane is a part of, is every month there's a list that's generated of people where this team goes out and takes a randomized set and does proactive mental health outreach. And because the metric we are looking at is reduction in recidivism rate over the next 12 months, we then have to wait 12 months after every set of people and see the recidivism rate overall versus the people we intervened on. And so we're testing kind of two things there. One is, does this overall program result in reduction of recidivism rates over 12 months? So we'll measure that. And we need enough data to know that that's a significant improvement, right? So if after 1 month we find it's not going down, that could mean two things. It could mean it's not working, Or it could mean that, well, we don't have enough numbers. The sample size is not large enough to know whether it's working or not working. So once you add up the 12 months of interventions and wait another 12 months to see the outcomes, at that point we have to realize that now we have enough data to measure the effect of this intervention, and we can see whether it's gone down or not. The second piece is it might be going down for certain types of people, but not for everyone. In which case we have to figure out, do we only apply it in the future to certain people and not to everyone, and think about new interventions for the rest? So I think the question becomes, if after 1 month or 2 months you're measuring the right thing, but nothing is changing, if your outcome is a 12-month recidivism outcome, then 2 months is not long enough to make any conclusions. In 12 months, we have data on the first month's interventions. And so then we have to figure out, is this data enough to make a conclusion? And there are ethical issues, and then there are more issues around what the goal was and the intervention. So I think the short version of this is that we should be monitoring, but then measuring the change in the goal that we defined up front. And in this case, it was reducing 12-month recidivism over that period of time. Other questions from people?
There are no more questions. Important to mention that we can only send you the slides if you registered for this webinar. So if you just arrive through Facebook, and which is great too, then you have to send us your email. You can direct message me and send us your email so we can send you the slides.
And we will not sell your email address for the small amount of money that we can make from it.
Yeah. So we really appreciate your interest in this, and hope you find this data science project scoping guide useful. And hopefully this curriculum will also spread around the world, and we look forward to hearing from you.
Yeah, feel free to contact us if you have questions or want to be part of any of this or help improve it.
Okay, bye.
Bye, everyone.